Hello students, this is Dr. Ravi Sani. Our today's discussion is about hemolytic disease of the newborn. So basically, HDN or hemolytic disease of the newborn, it is a result of the red cell alloimmunization, in which IgG class antibodies passes from the maternal circulation across the placenta into the circulation of the fetus, where they react with the fetal red cells and lead to the destruction. So alloimmunization means that the antigens or the antibodies are traveling or passing from the maternal circulation across the placenta into the circulation of the fetus, where they react with the fetal red cells and lead to their destruction. It has two specific conditions: ABO incompatibility or the ABO hemolytic disease of the newborn, or RH incompatibility or the RH hemolytic disease of the newborn. These are the two important conditions. Alloimmunization means passes of antibodies from maternal circulation to the fetal circulation, and they will cause destruction of the red cells in the fetus. Now come to the ABO incompatibility or the ABO hemolytic disease of the newborn. In this NTA and NTB antibodies found in the serum of group A and group B mothers usually have only IgM class antibodies, which cannot cross the placental barrier, and they will not show any effect on the fetal blood. Now come to the most of the mothers do not produce IgG class antibody as well, and if they are produced in a very small amount or produce any kind of severe effect in case of babies which will require any kind of treatment. But there is a specific condition: if mother is having O blood group, then these anti-A and anti-B antibodies of IgG class can cross the placental barrier and cause ABO, hemolytic disease of the newborn. Only this condition is specifically is fatal for fetal fetal blood cells or fetus. The mild course of this incompatibility is it is due to the immature development of the A and B antigens at birth, or the second concept is about the partial neutralization of the maternal IgG class anti-A or anti-B antibody. So in previous slide, we studied that most of the antibodies are of IgM class, which cannot cross the placental barrier. If they are producing IgG class, it is produced in a very small amount and do not cause any harmful effect in fetus or require any kind of treatment. A specific condition of group O individual in which these antibodies of IgG class cross the placental barrier and cause harmful effects. This condition is called the ABO hemolytic disease of the newborn. The reason for this mild course of mild effect of this hemolytic disease of the newborn due to immature development of the antigen A and antigen B, and the partial neutralization of the maternal Ig class anti-A or anti-B antibodies. So the effect of the antigen is neutralized. In contrast to RH hemolytic disease of the newborn, ABO disease may be found in the first pregnancy and may or may not affect subsequent pregnancies. ABO disease may be found in the first pregnancy and may or may not affect the subsequent pregnancy. But RH incompatibility will always have harmful effect or fatal effects in case of subsequent pregnancies. The universal recipient and universal donor. both antigen A and antigen B are present in a person with a blood group having AB positive, and if it has a Rh factor also positive, so recipient does not have any antibodies to these antigens, so the blood will not be rejected. This means a person who is having AB positive blood group is considered as the universal recipient. It is quite simple to understand. AB positive जो blood group है, in which both antigens are present, so definitely the anti-A and anti-B antibodies will be absent in the plasma, and it is having Rh positive factor, so Rh antibodies will also be absent in the plasma. So this person can get any kind of blood and considered as a universal recipient. If a person is having O negative blood group, they are considered as the universal donors. They can give blood to anyone. Around 7% of the population has O negative or the O blood group. Erythroblastosis fetalis. This is also known as the hemolytic disease of the newborn due to the Rh factor. So it is a special case of Rh incompatibility or mismatching which observed when Rh negative blood of a pregnant mother is carrying Rh positive fetus. So Rh antigens of the fetus do not get exposed to the Rh negative blood of the mother in the first pregnancy, as the two bloods are well separated by the placenta. So in first pregnancy, there will be no complications because both the bloods of mother and fetus are well separated. Mother is Rh negative and fetus is Rh positive, but their blood is well separated by the placenta. So there will be no complications in case of first pregnancy. The initial antibodies produced are of IgM class, which cannot cross the placental barrier. So in first pregnancy, if antibodies are formed, they are of IgM class, which cannot cross the placental barrier and will not have any kind of harmful effect. If some IgG antibodies are also produced, basically their production is delayed. So they will also not show any kind of harmful effect in case of first pregnancy. Basically, most of the antibodies are of IgM class, so they cannot cross the placental barrier. And if IgG antibodies are also produced, their production is delayed, so that's why they are also not affecting fetus in case of first pregnancy. Now come to the during delivery of the first child, there is a possibility of exposure of the maternal blood to small amounts of Rh positive blood from the fetus. So during second pregnancy, uh, during first pregnancy, when baby is delivered, in that case, placenta could rupture and can lead to the mixing of blood of mother and fetus. In such cases, the mother starts preparing antibodies against Rh antigen. So in case of subsequent pregnancies, the Rh antibodies, which are of IgG class from the mother, can leak into the blood of the fetus and destroy the fetal RBCs. This could be fatal to the fetus or could be responsible for severe anemia, jaundice. This condition is called erythroblastosis fetalis. So directly in first pregnancy, antibodies were not formed. When baby is delivered during first pregnancy, maternal blood exposed with the fetal blood, and the maternal blood started preparing antibodies against Rh antigen. So in subsequent pregnancies, these antibodies could be fatal for the baby and cause severe anemia, jaundice. This condition could be avoided by administration of anti-Rh antibodies to the mother immediately after the delivery of the first child.